Hello, my name is Donna Graham. I am a registered nurse and I am working on a master's degree at Lamar University. I was given the opportunity to speak with you about a study that I am proposing to do at this hospital regarding skin to skin contact and exclusive breastfeeding. As you know, breastfeeding is very important to our infants. And in fact, the World Health Organization has stated that if everyone exclusively breastfed for the first 6 months of their infant life and continued to breastfeed up to the age of 2 years old, 800 lives would be saved annually. Presently, unfortunately, less than 40% of infants are exclusively breastfed for up to 6 months. One thing that I read that I liked the sound of was called Womb with a View. Having mom and baby together for 1 hour after birth and keeping them safely skin to skin is kind of like having a womb with a view. If we can have the baby at the mother's skin without interruption for at least 1 hour, this alone increases the success of breastfeeding. In this hospital, in the year 2015 to 2016, for women's services, the initiation rate of exclusive breastfeeding was 82 to 92% depending on the month. The goal for exclusive breastfeeding was set at 65%, and by discharge, only 16 to 41% of our mothers were still exclusively breastfeeding. In the United States, the exclusive breastfeeding rate is 81%, and at 6 months, the exclusive breastfeeding rate for the United States is 22.3%. So for our purposes, despite our high initiation rates, exclusive breastfeeding rates here at this hospital still remain below the goal of 65%. We have some room for improvement. So the purpose of this study would be to investigate if skin-to-skin contact immediately after birth for at least 1 hour and one initial breastfeeding session increases the duration of exclusive breastfeeding done by our mothers. Included in this study would be any mother that wants to breastfeed, who's willing to do so exclusively, and of course is willing to be a part of the study. For now, it would include anyone having a vaginal delivery, because so far we have not implemented this in the operating room here at this hospital. And secondly, any infant who's compromised at birth for safety reasons, for ethical reasons, would not be included in the sample. That helps us, with a control group, because the mothers that don't want to breastfeed or exclusively breastfeed or want to be part of this skin-to-skin intervention, but still would like to be part of the study, can be in our control group. So with this study, we would have two variables. We would have an independent variable, which would be the skin-to-skin contact, and as far as statistics go, we can measure that at a nominal level. The dependent variable would be duration of exclusive breastfeeding, and that would be considered an interval level of measurement in statistics. We would have to think way back in school if we want to remember all about statistics. Then we would have a control group, and again that'll consist of the mothers who are unable or unwilling to participate in the intervention of skin-to-skin contact, but still would like to be in the study, and we would compare those two groups, the control group and the other group. As far as instruments, we can use a t-test to look for differences in length of time of exclusive breastfeeding between those who received the skin-to-skin contact intervention and those who did not. And we can also use the pi coefficient to seek a correlation between skin-to-skin contact and exclusive breastfeeding. For this study, I would define the variables on the questionnaire that we would use. Skin-to-skin contact would be meaning that the baby is placed between the mother's breasts with only a diaper on immediately at birth for 1 hour until after initial breastfeeding. Now, if they don't want a diaper on, that would be fine too. But the very minimum would be a diaper. Exclusive breastfeeding would be defined as feeding an infant from the breast. Now, some mothers do want to use a pacifier, and that would be okay in this study. We could still include it in the exclusive breastfeeding category, but we would not encourage the use of pacifiers. The first question that we would ask in the study is, did the mom participate in skin-to-skin contact as per the definition? And it would be a simple yes or no. Next, we would want to know if this mother was still exclusively breastfeeding at discharge. And last, we would want to know if the mom is still breastfeeding at 1 month. And that's where we would get our data to compare for the study. Now, I know it sounds kind of overwhelming at first, but if we work together, anything is possible. And I just want to thank you for your time. If anybody needs any of the references for the slideshow, I've included that on the last slide. So again, I think it'll be a neat study. It'll show whether or not skin-to-skin is effective with our population that we serve here, and I'd like to thank you for your time.